I want to ask the Minister the number of persons on CAM's waiting list in CHO4, and will you make a statement on the matter?
Mr. Donnelly.
Garv Mahagut, Deputy, for the question. A very important question, I might add. So the development of all aspects of mental health services nationally, including those for children and young people, remain a priority for me and the Government. This is reflected in the current programme for Government and in the significant additional funding allocated to mental health in Budget 21. As you will know, there was an extra 50 million secured, which will bring the budget to 1.076 billion. Of that 50 million, 23 million has been allocated to commence the implementation of many of the short-term recommendations of sharing the vision, including the expansion of the CAMS hubs. It is expected that 148 additional staff will be recruited in 2021 by the HSE, of which 29 will be in CAMS. As you know, Deputy, CAMS admissions are prioritised by clinical need. CHO4 continues to take a proactive approach with a focus on reducing CAMS waiting times to improve access to a safe and effective service. And I have to say, in the last 8 months, even with COVID, a lot of progress has been made. The CHO4 waiting list, which is Cork and Kerry, in October 2020 it was 352, a reduction from 573 in October 2019. 78 of those had been waiting to access CAMS services for longer than 12 months, so a reduction of 49% since January 2020. In October 2020, 93% of all accepted referrals, so these were referrals, were offered a first appointment within 12 weeks. And of those referrals, they were offered a first appointment, 96% were seen within 12 weeks. And I'll address more in the subsequent question.
Deputy Moynihan.
Minister, and I suppose this is vitally important that we get and that we keep challenging the system, keep challenging it in relation to CAMS, because all of us as public representatives inside here, we meet families in distress, we meet challenges that are out there, and we meet the difficulties that are about accessibility to CAMS. I suppose, there is a growing acceptance at this stage that there is a mental health crisis on the back of COVID. And I suppose the question I would ask you is, in the figures that are coming to you in the department from the HSE, do you see, a huge challenge, particularly on the CAM services and CHO4, and indeed the entire country? And, is there vacancies still within CHO4 in terms of psychiatrists, in terms of trained people to help and alleviate the crisis that's out there within the communities?
Deputy Minister Butler.
Thank you very much, Deputy. Yes, you raise a very, very valid point, and I've had several discussions with Minister Donnelly in relation to the CAMS waiting list since I've came into this role, and currently there are over 2,230 children waiting. But I have to say, in the last 7 to 8 months, CHO4 has taken a really proactive measure going forward. Now, part of the waiting list, especially in the Kerry side, was associated with a key consultant vacancy, and what they did then, they put in place a Saturday clinic facilitated by locum CAMS consultant cover to target the waiting list. But I can confirm, having spoken to the Chief Officer of CHO4 Cork and Kerry in the last week, they have secured a second consultant psychiatrist in CAMS in Kerry on a temporary basis. And both the teams in Cork and Kerry in relation to psychiatrists for CAMS are both fully populated now, and they are both working at full tilt, and we're working with them in order to reduce this waiting list as a matter of priority. It has always, from what I can see, been problematic in CHO4, where there was always quite a high waiting list in relation to CAMS, and I am adamant that I'm going to have that reduced, Deputy.
Thanks, Minister.
And I admire the Minister for her determination and I thank her for her work to date. There's a number of issues. Is there there a shortage of psychologists within the CHO4? Is there a challenge in getting psychologists there? And in primary care, in primary care, what is the Minister's view on how that is being rolled out, or how that is alleviating some of the stress that's out there within the community, and I suppose addressing the enormous challenges that I see myself that are going to be coming down the line in the next few months?
Minister.
A lot of challenges in relation to primary care for under 18s, and the waiting list is at an all-time high of 10,500. It's something I have inherited, but I have met with Minister Donnelly on this recently as well, and I've met with the primary care team from the HSE, and what we're working at the moment between primary care and the HSE and the Department of Mental Health in the Department of Health, we're looking at, currently there are over 5,000 under 18s on that waiting list with more than 12 months, and we're looking at a targeted intervention to reduce the waiting list next year. So currently there is a process being put in place to see where we can get the capacity. You are quite right, there are vacancies in relation to psychologists, so we're looking at a targeted approach, and I will be visiting Cork in January, February in the new year, COVID permitting, to meet the teams down there. A lot of good work has been done, but we have to do more, Deputy.
Minister.